Question 1. A pharmacy technician is preparing to restock the automated dispensing cabinet, ADC. Which of the following is the most effective strategy to prevent pick errors when placing medications with similar names or appearances? I. Restock all medications at the busiest time of day to ensure constant oversight. B. Place look-alike/sound-alike medications in different, non-adjacent locations within the ADC. C. Rely solely on the NDC number for verification during the restocking process. D. Ask a patient to verify the medication name before placing it into the ADC. Answer: B. Place look-alike/sound-alike medications in different, non-adjacent locations within the ADC. This question addresses medication error prevention, specifically concerning look-alike/sound-alike, loss of drugs, a common cause of dispensing errors. The most effective strategy to prevent pick errors with loss of medications is to physically separate them in storage, such as in an automated dispensing cabinet, ADC, by placing them in non-adjacent locations. This physical separation acts as a visual cue and barrier, significantly reducing the chance of selecting the wrong drug. For example, storing hydralazine and hydroxyzine far apart helps avoid confusion. Always remember that environmental organization is a key factor in reducing human error in the pharmacy. Question 2. A pharmacy technician discovers an expired medication on the shelf during a routine inventory check. What is the appropriate immediate action according to quality assurance principles? I. Return the medication to the manufacturer for a refund. B. Dispose of the medication immediately in the regular trash. C. Isolate and quarantine the expired medication in a designated area. D. Dispense the medication if the expiration date is only a few days past. Answer: C. Isolate and quarantine the expired medication in a designated area. This question tests knowledge about proper handling of expired medications, a critical component of inventory management and quality assurance. When an expired medication is found, the correct immediate action is to isolate and quarantine it in a designated area, clearly labeling it as expired or not for use. This prevents accidental dispensing and allows for proper documentation and subsequent disposal according to facility policy and regulatory guidelines, such as those for controlled substances or hazardous waste. Never dispense expired medications, as their potency and safety cannot be guaranteed. Question 3. What is the primary purpose of a root cause analysis, RK, in the context of pharmacy quality assurance? I. To assign blame to individuals responsible for medication errors. B. To identify the underlying systemic causes of an error or undesirable event. C. To quickly dismiss all reported medication incidents. D. To determine the financial cost of a medication error. Answer: B. To identify the underlying systemic causes of an error or undesirable event. This question focuses on the concept of root cause analysis, RK, a fundamental tool in continuous quality improvement, CQI. The primary purpose of an RCA is not to blame individuals, but rather to delve deeper into an incident, such as a medication error, to uncover the fundamental reasons why it occurred. By understanding the systemic issues, like faulty processes or inadequate training, the pharmacy can implement targeted changes to prevent recurrence. For instance, if an RCA reveals that similar-looking medication labels led to an error, the solution might involve new labeling standards rather than punishing the technician. Remember that RCA aims to improve the system, not just fix a symptom. Question 4. Which organization develops a do not use list for abbreviations, acronyms, and symbols to reduce medication errors? I. Drug Enforcement Administration, D. B. Food and Drug Administration, FDA. C. Institute for Safe Medication Practices, ISMP. D. Occupational Safety and Health Administration, OSHA. Answer: C. Institute for Safe Medication Practices, ISMP. This question assesses knowledge of key organizations involved in medication safety and their specific contributions to quality assurance. The Institute for Safe Medication Practices, ISMP, is a nonprofit organization dedicated to preventing medication errors and publishes the well-known ISMP list of error-prone abbreviations, symbols, and dose designations, often referred to as the Do Not Use list. This list guides healthcare professionals on abbreviations that have frequently led to medication errors, encouraging safer communication. For example, writing unit instead of U helps prevent misinterpretation. Always consult ISMP resources for best practices in medication safety. Question 5. When preparing sterile compounds, what is the most critical quality assurance measure to prevent contamination? I. Storing all supplies in a locked cabinet. B. Wearing appropriate personal protective equipment, PPE, and using a septic technique. C. Labeling compounds with only the patient's name. D. Disposing of used syringes in a regular trash can. Answer: B. Wearing appropriate personal protective equipment, PPE, and using a septic technique. This question highlights a crucial aspect of quality assurance in sterile compounding, preventing contamination. The most critical measure is the consistent use of appropriate personal protective equipment, PPE, such as gowns, gloves, and masks, combined with strict adherence to a septic technique, which means performing all manipulations in a way that prevents microbial contamination. This practice ensures that the compounded sterile product remains free from harmful microorganisms. For example, properly gloving and sanitizing hands before entering the buffer area directly reduces the risk of introducing contaminants. Always prioritize a septic technique and proper garbing in sterile compounding to safeguard patient health. Question 6. A pharmacy technician is required to document the refrigerator temperature daily. This practice is primarily a component of which quality assurance activity? I. Inventory management. B. Medication disposal procedures. C. Equipment maintenance and monitoring. D. Patient counseling. Answer: C. Equipment maintenance and monitoring. This question focuses on a common quality assurance task related to medication storage. Documenting refrigerator temperature daily is a direct example of equipment maintenance and monitoring, ensuring that temperature-sensitive medications are stored within their recommended range to maintain potency and stability. Fluctuations outside the acceptable range could render medications ineffective or harmful, necessitating their removal from stock. For instance, insulin stored above the recommended temperature might degrade and become less effective for a diabetic patient. Consistent temperature logging helps confirm that storage conditions meet regulatory and manufacturer requirements, directly contributing to medication integrity. Question 7. What does the acronym USP primarily refer to in pharmacy practice, especially concerning quality assurance and compounding? I. United States Pharmacy. B. Universal Safety Protocols. C. United States Pharmacopoeia. D. Uniform Standard Procedures. Answer: C. United States Pharmacopoeia. This question tests knowledge of a fundamental standard-setting organization relevant to pharmacy quality assurance, particularly in compounding. USP stands for United States Pharmacopoeia, which is a non-governmental organization that sets official public standards for all prescription and over-the-counter medicines and other healthcare products manufactured and sold in the United States. These standards, such as USP less than 797 for sterile compounding and USP less than 795 for non-sterile compounding, ensure the quality, purity, strength, and consistency of pharmaceutical products, directly influencing quality assurance practices in pharmacies. Understanding these guidelines is crucial for safe and effective compounding. Question 8. In a pharmacy, a medication guide is primarily intended to provide information to whom? I. The prescribing physician. B. The pharmacy technician. C. The patient. D. The insurance company. Answer: C. The patient. This question assesses understanding of medication guides, an important tool for patient safety and quality assurance in medication use. A medication guide is a paper handout that comes with many prescription medicines approved by the FDA, to provide crucial information to the patient about how to use the medicine safely and effectively. It includes details on potential side effects, instructions for use, and warnings, empowering patients to manage their medications better and reducing the risk of adverse events. For instance, a medication guide for a new antidepressant might warn about increased risk of suicidal thoughts in young adults. Always ensure patients receive their medication guides when required, as it is a vital part of patient education. Question 9. Which of the following is an example of a high-alert medication that requires special precautions to prevent errors? I. Ibuprofen. B. Normal saline. C. Insulin. D. Vitamin C. Answer: C. Insulin. This question addresses the concept of high-alert medications, which are drugs that bear a heightened risk of causing significant patient harm when used in error. Insulin is a classic example of a high-alert medication because an incorrect dose can lead to severe hypoglycemia or hyperglycemia, potentially resulting in coma or death. Pharmacies implement specific quality assurance measures for these drugs, such as independent double checks by 2 different individuals to minimize the risk of error. For example, before dispensing insulin, both the technician and the pharmacist should verify the drug, dose, and patient. Always exercise extreme caution and follow all protocols when handling high-alert medications. Question 10. What is the primary purpose of a medication error reporting system within a pharmacy? I. To publicly shame staff members who make errors. B. To collect data for identifying trends and implementing preventive strategies. C. To immediately fire employees who report errors. D. To determine which patients are most likely to sue the pharmacy. Answer: B. To collect data for identifying trends and implementing preventive strategies. This question clarifies the fundamental purpose of medication error reporting systems, which are essential for quality assurance and patient safety. The primary purpose of such a system is not to assign blame, but to create a non-punitive environment where staff can report errors or near misses without fear. This reporting allows the pharmacy to collect vital data, analyze trends, and identify systemic weaknesses that contribute to errors. By understanding these patterns, the pharmacy can then develop and implement effective preventive strategies and process improvements. For example, if multiple reports concern similar-looking packaging, the system can trigger a review of inventory arrangement. Encourage a culture where reporting errors is seen as an opportunity for improvement. Question 11. When a pharmacy technician receives a new prescription for a patient, what is the most important quality assurance step before dispensing? I. Checking the patient's favorite color. B. Verifying the patient's allergy information against the prescribed medication. C. Confirming the patient's preferred TV show. D. Asking about the patient's last vacation destination. Answer: B. Verifying the patient's allergy information against the prescribed medication. This question highlights a crucial patient safety and quality assurance step during the prescription processing workflow. Before dispensing any new medication, it is paramount to verify the patient's allergy information against the prescribed drug to prevent potentially life-threatening allergic reactions. This step is a critical safeguard against prescribing or dispensing errors. For example, if a patient is allergic to penicillin and a penicillin-class antibiotic is prescribed, this check would flag the interaction. Always prioritize patient safety by cross-referencing allergies with new medications. Question 12. What is the significance of the Beyond Use Date, BUD, for compounded preparations? I. It indicates the manufacturer's original expiration date. B. It is the date the compounding process began. C. It specifies the time after which a compounded preparation should not be used. D. It refers to the date the prescription was written. Answer: C. It specifies the time after which a compounded preparation should not be used. This question defines the critical concept of the Beyond Use Date, BUD, in compounding, which is a key element of quality assurance for prepared medications. The BUD is the date and time after which a compounded sterile or non-sterile preparation should not be stored or used, and it is determined by the stability of the ingredients and the conditions under which it was prepared and stored. Unlike an expiration date, which applies to manufactured products, the BUD accounts for the specific conditions of compounding. For example, an antibiotic suspension compounded from a powder will have a much shorter BUD once reconstituted than its original expiration date. Always accurately calculate and label the BUD to ensure product efficacy and patient safety. Question 13. Which of the following is a key component of a pharmacy's quality assurance program regarding sterile compounding personnel? I. Requiring all sterile compounding staff to complete a yearly fantasy football league. B. Ensuring sterile compounding personnel complete competency testing, including media fills, at least annually. C. Mandating that all sterile compounding be performed in a separate, completely dark room. D. Limiting sterile compounding tasks to only certified pharmacists, excluding technicians. Answer: B. Ensuring sterile compounding personnel complete competency testing, including media fills, at least annually. This question focuses on the quality assurance requirements for personnel involved in sterile compounding, a high-risk activity. A key component of a robust quality assurance program is ensuring that all sterile compounding personnel, including technicians, undergo regular competency testing, which typically includes didactic assessment, observation of a septic technique, and media fill tests. Media fill tests involve compounding a sterile growth medium under realistic conditions and incubating it to detect any microbial contamination, thereby proving the individual's ability to compound aseptically. For example, a technician must successfully pass an annual media fill to demonstrate continued proficiency. Regular competency assessments are vital to maintaining high standards of sterility and preventing patient harm. Question 14. What is the primary role of independent double checks in pharmacy dispensing? I. To speed up the dispensing process. B. To identify potential errors before medication reaches the patient. C. To reduce the number of staff required in the pharmacy. D. To solely confirm the billing information for prescriptions. Answer: B. To identify potential errors before medication reaches the patient. This question addresses the important safety strategy of independent double checks in pharmacy operations. The primary role of independent double checks is to have a second person independently verify the accuracy of a prescription or medication preparation, acting as a critical safety net to catch potential errors before the medication reaches the patient. This technique is especially important for high-alert medications or complex compounding. For instance, one technician might prepare a medication, and another technician or pharmacist would independently verify the drug, dose, and patient information against the original order. This process significantly reduces the risk of dispensing errors and enhances patient safety. Question 15. A pharmacy technician observes a colleague consistently taking shortcuts during the medication labeling process. What is the most appropriate quality assurance action? I. Ignore the behavior, as it speeds up workflow. B. Confront the colleague aggressively in front of patients. C. Report the observation to a supervising pharmacist or manager. D. Start taking shortcuts as well to keep up with the colleague. Answer: C. Report the observation to a supervising pharmacist or manager. This question presents a scenario testing the technician's understanding of professional responsibility and quality assurance in reporting unsafe practices. When a technician observes a colleague taking shortcuts that could compromise patient safety or violate pharmacy protocols, the most appropriate action is to report the observation to a supervising pharmacist or manager. This allows for proper intervention, education, and correction of unsafe practices, maintaining quality and safety standards without creating a hostile work environment. For example, shortcuts in labeling could lead to wrong drug or wrong dose errors, and reporting it allows management to address the systemic issue or provide retraining. Always prioritize patient safety by addressing non-compliance through appropriate channels. Question 16. What is the term for a systematic process used to identify and assess potential failures in a process before they occur, and to determine their effects? I. Root cause analysis, RK. B. Failure mode and effects analysis, FME. C. Continuous quality improvement, CQI. D. Incident report. Answer B. Failure mode and effects analysis, FME. This question defines a key proactive risk management tool used in quality assurance. Failure mode and effects analysis, FMEA, is a systematic, proactive method used to identify potential failure points, failure modes, within a process, assess their potential impact, effects, and prioritize actions to prevent them. Unlike root cause analysis, which is reactive and looks back at errors that have already occurred, FMEA is forward-looking and aims to prevent errors before they happen. For instance, an FMEA might be used to evaluate a new medication dispensing system to identify possible design flaws that could lead to errors. Understanding and applying FMEA helps build safer systems from the ground up. Question 17. The requirement for a specific manufacturer to implement a risk evaluation and mitigation strategy, REMS, program for a drug is determined by which agency? I. DEA, Drug Enforcement Administration. B. FDA, Food and Drug Administration. C. CDC, Centers for Disease Control and Prevention. D. USP, United States Pharmacopeia. Answer B. FDA, Food and Drug Administration. This question assesses knowledge of regulatory agencies and specific programs designed to enhance medication safety. The Food and Drug Administration, FDA, is the federal agency responsible for determining whether a risk evaluation and mitigation strategy, REMS, is necessary for a drug. A REMS program is required for certain medications with serious safety concerns to ensure that the benefits of the drug outweigh its risks. This might involve special patient education, specific dispensing requirements, or restricted access programs. For example, isotretinoin, used for severe acne, has a REMS program called iPledge due to its severe teratogenicity causing birth defects. Always be aware of drugs requiring REMS programs, as they involve specific dispensing protocols for patient safety. Question 18. What is the purpose of maintaining a controlled substance inventory log in the pharmacy? I. To track non-prescription items for reordering. B. To comply with DEA regulations and prevent drug diversion. C. To monitor patient adherence to their medications. D. To determine the most profitable drugs for the pharmacy. Answer B. To comply with DEA regulations and prevent drug diversion. This question highlights a critical quality assurance and regulatory compliance task in the pharmacy involving controlled substances. Maintaining a controlled substance inventory log is essential for complying with Drug Enforcement Administration, regulations and preventing drug diversion, which is the illicit use or transfer of controlled medications. The log provides a precise record of all controlled substances received, dispensed, and wasted, ensuring accountability and security. For instance, a physical count and log entry are required every time a Schedule II narcotic is dispensed. Accurate and up-to-date logs are crucial to ensure legal compliance and patient safety. Question 19. A pharmacy technician is preparing a non-sterile compound. What document should be followed to ensure consistent quality and accurate preparation? I. The daily weather forecast. B. A standard operating procedure, SOP, or master formulation record. C. A newspaper article about new drugs. D. The latest celebrity gossip magazine. Answer B. A standard operating procedure, SOP, or master formulation record. This question focuses on quality assurance in non-sterile compounding. To ensure consistent quality and accurate preparation of a non-sterile compound, a pharmacy technician must follow a standard operating procedure, SOP, or a master formulation record. These documents provide detailed, step-by-step instructions for compounding a specific preparation, including ingredient quantities, mixing instructions, and storage requirements. Adhering to these established protocols minimizes variability and errors, ensuring that each batch of the compound meets the required quality standards. For example, an SOP for a diaper rash cream would detail the exact amount of each ingredient and the mixing order. Always rely on approved SOPs and master formulation records for safe and effective compounding. Question 20. What is the primary purpose of barcode medication administration, BCMA, in a hospital setting? I. To allow nurses to chat with pharmacy technicians more easily. B. To verify the right patient, right medication, right dose, right route, and right time at the point of care. C. To replace the need for pharmacists to review medication orders. D. To track the inventory of non-pharmaceutical supplies. Answer: B. To verify the right patient, right medication, right dose, right route, and right time at the point of care. This question addresses barcode medication administration, BCMA, a critical technology for enhancing patient safety and quality assurance in medication delivery. The primary purpose of BCMA is to use barcodes on patient wristbands and medication packages to electronically verify the 5 rights of medication administration: right patient, right medication, right dose, right route, and right time at the point of care, usually by a nurse immediately before administration. This system significantly reduces medication errors by creating an electronic double-check. For example, scanning the patient's wristband and then the medication ensures correct patient and drug matching. BCMA is a powerful tool in reducing adverse drug events in institutional settings. Question 21. Which of the following best describes the role of a pharmacy technician in identifying and reporting adverse drug events, ADEs? I. Technicians are not involved in ADE identification or reporting. B. Technicians should only report ADEs if a patient complains directly to them. C. Technicians should recognize potential ADEs and report them to the supervising pharmacist. D. Technicians should independently submit ADE reports directly to the FDA. Answer: C. Technicians should recognize potential ADEs and report them to the supervising pharmacist. This question clarifies the pharmacy technician's role in patient safety regarding adverse drug events, ADEs. While pharmacists are primarily responsible for clinical assessment and official reporting, pharmacy technicians play a crucial role in identifying potential ADEs through patient interactions, data entry, or observation, and then reporting these observations promptly to the supervising pharmacist. The pharmacist can then evaluate the event, determine if it's an ADE, and initiate appropriate reporting to agencies like the FDA via MedWatch or the institutional reporting system. For example, if a patient mentions unusual swelling after starting a new medication, the technician should inform the pharmacist immediately. Always remember that early detection and reporting are vital for patient safety. Question 22. What is the primary reason for conducting routine audits of prescription orders and dispense medications? I. To identify the fastest dispensing technicians. B. To verify the accuracy and completeness of records and identify potential discrepancies or errors. C. To determine which physicians prescribe the most medications. D. To entertain staff with historical data. Answer: B. To verify the accuracy and completeness of records and identify potential discrepancies or errors. This question addresses the core purpose of routine audits in a pharmacy, a fundamental quality assurance activity. The primary reason for conducting routine audits of prescription orders and dispense medications is to systematically verify the accuracy, completeness, and compliance of records with regulatory and internal policies. These audits help identify potential discrepancies, errors, or areas for improvement in the workflow. For example, an audit might reveal a consistent issue with missing signatures on hard copy prescriptions, prompting a review of the intake process. Regular audits are a proactive way to maintain high standards of patient safety and regulatory compliance. Question 23. A pharmacy implements a new electronic prescribing system. What quality assurance step is most crucial before fully implementing the system? I. Immediately discontinue all paper prescriptions. B. Thoroughly test the system for accuracy and functionality with test data. C. Allow all staff to use the system without any training. D. Purchase new computers for every workstation. Answer B. Thoroughly test the system for accuracy and functionality with test data. This question focuses on quality assurance principles when introducing new technology in the pharmacy. Before fully implementing a new system, like an electronic prescribing system, it is crucial to thoroughly test it with test data to ensure its accuracy, functionality, and compatibility with existing workflows. This proactive testing helps identify and rectify potential glitches or errors that could compromise patient safety or operational efficiency before real patient data is used. For example, testing ensures that drug allergy interactions are correctly flagged and doses are accurately transmitted. Always prioritize rigorous testing of new systems to prevent errors and ensure smooth transitions. Question 24. Which action is an example of proactively preventing medication errors related to similar-sounding drug names? I. Using tall man lettering on drug labels and storage bins. B. Only stocking drugs with unique names. C. Relying on patient memory to distinguish medications. D. Writing all drug names in all capital letters. Answer I. Using tall man lettering on drug labels and storage bins. This question asks about proactive strategies to prevent medication errors, specifically those caused by similar-sounding or similar-looking drug names, loss of drugs. Using tall man lettering, where dissimilar parts of drug names are capitalized, e.g., hydralazine and hydroxyzine, is a widely recognized and effective proactive strategy. This visual differentiator helps reduce confusion and minimize the risk of selecting the wrong medication. For instance, clearly labeling bins and prescription vials with tall man lettering helps both technicians and pharmacists identify the correct drug quickly. Always use visual cues like tall man lettering to enhance safety and prevent medication mix-ups. Question 25. What is the purpose of conducting regular in-service training for pharmacy technicians? I. To discuss personal matters unrelated to work. B. To ensure technicians maintain and enhance their skills and knowledge on new procedures or medications. C. To replace the need for formal certification. D. To determine staff eligibility for vacation time. Answer B. To ensure technicians maintain and enhance their skills and knowledge on new procedures or medications. This question addresses the importance of continuous education in maintaining quality and competency in the pharmacy. The purpose of conducting regular in-service training for pharmacy technicians is to ensure they maintain and enhance their skills, stay updated on new medications, procedures, regulations, and technology, and reinforce best practices. This ongoing education is a critical component of a pharmacy's quality assurance program, directly impacting patient safety and operational efficiency. For example, training on a new compounding technique or changes in controlled substance handling ensures everyone is performing tasks correctly. Consistent training helps improve performance and reduce errors. Question 26. A pharmacy technician is responsible for restocking the refrigerator with temperature-sensitive medications. What quality assurance step should be performed immediately upon receiving these medications from the supplier? I. Place the medications directly onto the display shelf. B. Verify the medication's temperatures upon arrival and promptly place them into the refrigerator. C. Leave the medications out at room temperature for an hour before refrigerating. D. Dispose of the packaging without checking the contents. Answer B. Verify the medication's temperatures upon arrival and promptly place them into the refrigerator. This question addresses the crucial quality assurance step for handling temperature-sensitive medications upon their arrival in the pharmacy. It is essential to verify the medication's temperatures upon arrival to ensure they have been maintained within the appropriate range during transit, and then promptly place them into the refrigerator or freezer. This immediate action prevents temperature excursions that could compromise the drug's potency or stability. For example, if vaccines arrive warm, their efficacy could be ruined. Always prioritize immediate and proper storage for temperature-sensitive items to maintain medication quality. Question 27. What is a key role of a pharmacy technician in managing medication recalls? I. Independently decide which recalled medications to keep on the shelf. B. Identify and remove recalled medications from stock and assist in patient notification. C. Advise patients to ignore recall notices. D. Place recalled medications in the regular dispensing area for quick access. Answer B. Identify and remove recalled medications from stock and assist in patient notification. This question focuses on the pharmacy technician's critical role in managing medication recalls, which is a vital quality assurance and patient safety function. When a medication recall is issued, the technician's key role involves promptly identifying and physically removing the recalled medications from all storage areas, shelves, automated dispensing cabinets, patient bins, to prevent dispensing them. They also often assist the pharmacist in identifying affected patients and preparing notifications. For example, after receiving a recall notice for a specific lot number of an antibiotic, the technician must locate and quarantine all vials from that lot. Swift and accurate handling of recalls protects patients from potentially harmful or ineffective drugs. Question 28. How does proper disposal of hazardous pharmaceutical waste contribute to quality assurance and safety? I. It increases the pharmacy's operational costs. B. It prevents harm to the environment and personnel and avoids regulatory penalties. C. It makes the pharmacy look tidier. D. It reduces the need for drug inventory. Answer B. It prevents harm to the environment and personnel and avoids regulatory penalties. This question highlights the importance of proper hazardous pharmaceutical waste disposal as a component of quality assurance and overall safety. Proper disposal is crucial because it prevents environmental contamination, protects pharmacy personnel and the public from exposure to potentially harmful substances, and ensures compliance with strict regulatory requirements from agencies like the Environmental Protection Agency (EPA). Incorrect disposal can lead to severe fines and environmental damage. For example, chemotherapy drugs must be disposed of in specific biohazard containers, not regular trash. Always follow established protocols for hazardous waste to ensure safety and compliance. Question 29. A pharmacy technician receives a medication order with an illegible prescriber's signature. What is the appropriate quality assurance action? I. Dispense the medication as written, assuming it's valid. B. Guess the prescriber's name and proceed with the order. C. Contact the prescriber's office for clarification and verification of the order. D. Ask the patient to identify the prescriber's signature. Answer C. Contact the prescriber's office for clarification and verification of the order. This question addresses a common scenario requiring critical thinking for patient safety and quality assurance. When a pharmacy technician receives a medication order with an illegible prescriber's signature or any ambiguity, the appropriate and essential quality assurance action is to contact the prescriber's office for clarification and verification. Dispensing an order that is unclear or potentially unverified can lead to serious medication errors. For example, an illegible signature could lead to misidentifying the prescriber, making it impossible to confirm the order if questions arise. Always prioritize patient safety by resolving any ambiguities in a prescription before processing it. Question 30. What is the main purpose of medication reconciliation during patient admission or discharge from a hospital? I. To create a new list of medications for the patient. B. To compare the patient's current medications with the newly ordered medications to prevent discrepancies. C. To determine which medications are most expensive. D. To remove all medications from a patient's profile. Answer B. To compare the patient's current medications with the newly ordered medications to prevent discrepancies. This question defines medication reconciliation, a crucial patient safety process in healthcare transitions. The main purpose of medication reconciliation is to systematically compare a patient's current list of medications with the newly ordered medications during admission, transfer, or discharge from a healthcare facility. This process helps identify and resolve any discrepancies, such as omissions, duplications, or incorrect dosages, thereby preventing medication errors and adverse drug events. For example, ensuring that a patient's home blood pressure medication is continued or adjusted correctly upon hospital discharge is vital. Always ensure accurate medication reconciliation to maintain continuity of care and prevent medication-related harm.